In our sponsored segment today, Andrew Reinhardt with Wasatch Medical Clinic in Murray is here to talk about a treatment for erectile dysfunction and men not taking that pill that they don't like doing anymore.
Yeah, what a breath of fresh air. Nobody wants to take the pill for ED. You have the headaches and the blurred vision, no spontaneity. I don't know anybody that wants to go through that process.
Andrew, is this a medical issue that unfortunately is very common?
I think it is. They say 50% of men over 50 get erectile dysfunction. I personally think the number is a lot higher. There's so many guys suffering in silence with this.
And you actually say you see men of every single age come into the clinic.
Absolutely. 20s and 30s, 80s and 90s, and everything in between. We've seen it.
Do you have people saying to you, is this real?
Yeah.
Does it really work?
We do.
And how do you respond?
That's the number one question. I say go to the science page at wasatchmedicalclinic.com and read study after study. Cambridge University, a recent urological study said this is the new standard of care for ED. So the science is quite substantial.
How does it work?
It uses pressure waves that open up blood vessels, essentially. So it's placed on the skin. It agitates the blood vessels just enough that they regrow. That's a medical term known as neovascularization. There you can kind of see what it's doing.
What are we seeing in that picture?
You're seeing the way that a man ages is dying and shriveled up blood vessels on the left.
Okay.
What our treatments do on the right. ED is a blood flow problem, so that's what we're improving.
This isn't talked about because it's tough to talk about, I think, for so many men and so many couples. Are they just suffering? Is their relationship suffering in silence?
I think so. I think men are just a little bit hesitant. The stigma around getting this treated is maybe kind of dangerous because it holds men back and then the relationship suffers.
And what about feeling like, does it hurt and is it invasive?
Yeah, it's not either of those. It's done on top of the skin. It doesn't hurt. No recovery time. A man can come in on his lunch break. Keep in mind you do a few short 10-minute treatments over 2 to 3 weeks. That's it.
Okay, how many treatments does a patient typically need?
The Cambridge study said 3 weeks of treatments, and I would say that will be between 3 and 6 treatments total.
If you don't do anything, will ED go away?
Unfortunately not. Kind of like maybe our eyesight or hearing. Once it starts to get worse, it kind of heads that direction faster.
What about testosterone? Can that work?
Well, we've seen that helps with maybe drive and energy, but erectile dysfunction is a physical blood flow problem and it needs a physical solution.
All right, if you have questions, what's the best thing to do? Should you come in or call?
I would call and set up the consultation with our doctor. It's an exam and an assessment and a blood flow ultrasound, and we're doing it at no charge.
All right, can you give everyone that phone number?
Yes, call 801-901-8000, and the number is on your screen there as well.
We should also let you know they've expanded. We mentioned the Murray location, but you are also in St. George. So if you are in southern Utah, everyone, and you're thinking, I have questions, you can definitely get those answered. Call that phone number right there on your screen, and also go to our website, and we will link you. That's abc4.com/midday, and it is Wasatch Medical Clinic. Andrew, thank you so much.
Thank you, Nisha.
We'll be right back.